Okay, well, again, good morning. Morning. It's like a children's sermon, but you're stuffing your faces instead of just... Please continue to keep eating. Please feel free to go up and fill your plate as we talk. There's a little bit of food left, so please help yourselves. I want to say first, again, thank you all for coming back. That's always the test of something. You know, it's great when people come the first time, but when they come back a second time, then something must be there. So we're glad you came back for our second program in this series called Graceful Endings, as we kind of explore our calling and especially the call around the end of life and death. So I just want to share a couple things really quick. The first is something I found on Facebook just the other day. It's this little thing that says, adulthood is saying, but after this week things will slow down a bit, over and over until you die.
Pretty much.
Yeah. I found this. It stood out to me because, one, it's funny. Two, it's very true. But three, as we were having these conversations around getting to the end of life and preparing for that, this seems very relevant. We think we'll get to it next week. We'll have time to do something next week, next month. We have time. But that time just seems to keep pushing forward, you know. So thank you for taking this time to think through this with all of it. As we've been going through this program and exploring this topic, I've begun to notice a lot of things in the world that kind of point to this, and so a lot of other people are thinking about this. Does anyone know what October 30th is? Halloween Eve, yes. I guess no one knows that October 30th is Create a Great Funeral Day. It's October 30th, the day you're supposed to sit down, if you have not done it, and create a great funeral. My sister sent this to me. She's found this online somewhere. A lady about a decade ago, I think, kind of got the ball rolling on it from different circumstances in life and just said she's experienced too many times where people don't have these plans made. And so she created this day, and if you search it, it'll come up and you can find resources. She has a whole website of resources for funeral planning and all kinds of things. So October 30th is the day if you want. At the end of last month, I shared a number of books that could be resources. I never made that list, didn't I? Someone make a list of books. And anyway, Kim was at the library, our library here in town, and found this book, which is new this year. It's called A Beginner's Guide to the End, Practical Advice for Living Life and Facing Death. The main author is a hospice medical doctor and palliative doctor. It looks good, and the good news is it's at our library. The bad news is it's at our house right now. So we'll get it back there, and you can check it out, but that was another resource. Looking ahead now to next month in our series, we're going to gather for, I don't know if the committee even knows this, for a night called I'll Have the Soup. I don't know how long we're going to keep this food thing going, but for at least one more month, we're going to gather on a Wednesday night, Wednesday, November 13th, probably 7 p.m. We'll have some soup, and we'll also have Reverend Ann Kyle. She serves at Christ and Trinity, Lutheran in Sedalia, and Calvary Episcopal. But she is a former nurse as well and has done a lot of this planning. And I think I said last month, I asked her what topic she would be most interested in. She said, an advanced healthcare directive. I said, I don't even know what that is, so I'll come and find out. But she said it's something that's very important, and so she'll talk about that, I'm sure, among other things. So Wednesday, November 13th. Plan on our next program. And the last thing, and this is something that came out of last month, and this was kind of the point of starting the whole thing, was after we met last month and explored the topic, more than a few people came up to us, we had conversations and said, what's next? We said, oh, we're going to have this session about finances and insurance, and then we'll talk about advanced directives. They said, no. What's next after all that? What happens if we have all that stuff done and we've gotten to that point and our loved ones have died, and then what? And I think it's a question I've been avoiding for a while here. And so what I would like to do is to kind of start a grief gathering for those who would like to come together and just talk about grief. I think it's different than all the preparation and planning around death and dying. I think this is, we all grieve different things, different people, and I know some people really need the people around them to grieve with. And I think we've avoided this because we just don't know what to do. So I would like to offer my time on Sunday, November 17th. It's the day that's the day of the chili cook-off for the Luther League and the pitch tournament, so it's a busy day already, but that evening I'm going to be here and would be happy to sit with anyone who'd like to come and just talk about grief. We'll do some Bible study and prayer and just, I'm not sure exactly what it's going to look like, but we want to offer that time for those who might need it. So we'll get more word out about that, but again, that, like I said, that came out of last month and the conversations we were having. So we are delighted and honored to have from all the way across the street Sandy and Paul, who you know well, but who probably don't get to share this side of their life with all of us unless you all go to their office. So we're just grateful that they're here, so thank you.
Okay. Is that on?
You're on.
Okay. Very good.
We have some handouts that basically is everything we're going to talk about today. And someone said, well, it'd be nice if we had something to write on. So we provided you something to write on. And I also have this table. I also have some pens from all different kinds of insurance companies all over the world. Let's see if I did this right.
Got it? Okay.
I think so. And they're in the box. Yeah, good, Teresa.
We've titled our presentation today as Preparing for Life and Death, and some of the practical matters that entails. One thing that came to mind to me, though, is as I was looking through all this, is there was a time in Jesus' ministry when when a lawyer came to him, a lawyer being a person who is an expert in the law of Moses. So he's kind of setting up Jesus in a way to embarrass him in front of the crowd. And he says, "Teacher, what must I do to inherit eternal life?" Jesus said, "You're a lawyer. What do you say?" And he said, he quoted the Shema, the thing that says, "Love the Lord your God with all your heart, mind, and soul, and love your neighbor as yourself." Jesus said, "You've spoken correctly. Do those things and you'll have eternal life. And you'll have a good life now. Because that is the greatest of all the commandments." Wow. That's the greatest of all the commandments. So what he's saying to us is caring for yourself and others is the heart of living your life out. And that's what we're going to talk about a little bit today. Sandy, you got it?
Yeah.
Okay.
Okay.
What we do in our profession. Now, of course, I was a pastor for 25 years, but I've also been an insurance agent for almost 20 years. A lot of people don't know that. I was 3 years in that line of work before I went to seminary, and then I've been at this for 17 years. So it's 20 years now that I've been in this, almost as long as I was in the ordained ministry. But it's an extension of my ministry. I don't see it all that much different than when I was an active minister called to the church. It's still the same thing, caring about myself and caring about others. And helping them prepare for what's to come. That comes in ways of health insurance and even life insurance. The realities of our life today. What do we have to do to stay healthy? And what do we have to do to prepare for the inevitable, which of course is our demise? And what does that mean for us? These are questions that we all wrestle with from time to time.
One of the first stories that Paul told me when we first met, before we ever thought we'd end up back in the world of insurance, was a situation that he had in Denver, Colorado. And I think it's an interesting way to show how while we live and before we die and as we die, the implications that can have on people's lives by making just a couple of decisions. You want to share that story?
Yeah, I was called to a home out in Brighton, Colorado, to an elderly couple who wanted to talk to me about a Medicare supplement. This is 1977. And so I, in a snowstorm practically, went out to their trailer that was out, in middle of Brighton, and talked to this man. He didn't know, actually she's the one, the wife is the one who asked me to come. He didn't know I was coming. Some of you will remember this story in a way because when I first met Sandy, and we were, well, didn't first met her, but when we were getting married, it was printed in the Lutheran Standard, the story that I'm talking about today. I'd written that out in this Lutheran Standard, the old Lutheran Standard printed that story, the cigar-chewing old man. But I went into his home, and he was a gruff man. He was not very welcoming. He was very in-your-face kind of thing. And then I could tell from his accent, though, that he was from Texas. Having been born there myself, and having a mother that's got a very thick accent, I picked up on it right away. So we got to know each other through that avenue. He's a Texan. And I ended up spending 3 hours there and having dinner with them. They wouldn't let me go. And so, yeah, that was my first supplement that I ever sold. To supplement his Medicare. Oh, a few weeks later, about 3 weeks later, I got a call from her again, saying that her husband had been taken to the hospital. But their pastor was gone. And they were both Baptists, as I was at the time. And they said, he's gone. Nobody's around. And my husband said, could you come? I'm an insurance agent. I said, but I thought to myself, why not? And I said, sure, I'll come. Where is he? And he was at the University of Colorado Medical Center down on Colorado Boulevard. So I got my car, I went there, and I saw him. She met me in the hallway, and he wasn't doing well. In fact, not doing well at all. He had had some heart issues before, and they'd flared up again. And so when I walked in there, we had some quiet banter back and forth, how you doing, big guy, that kind of stuff, And then after a while, after that talking with him for a while, I said, I could tell they wanted more than that. And I said, would you like me to pray with you? He said, yes, I would very much like that. And so I had her come over, we held hands, and we prayed together for a while, for whatever was to come. And he's laying on his back, but the tears were just running down the back of his face, all the way down to his pillow. Powerful moment for an insurance agent. It was one of those things that actually kind of prompted me to think perhaps I should go into the ministry and start listening to my pastor who was encouraging me to do that. But I sat there and I thought, I was present with them. I found out from her the next day that he had died that night. Pretty powerful stuff. And I was just being myself. But we talk about vocation, we talk about calling. And you don't have to be a pastor to do that. You know, it was just being present with someone in that dying process. He was a dying man and he knew it. And those prayers meant a lot to him. And I didn't realize all of this really until, as I reflected on it later, just how special that moment was. But anyway, that's kind of what it was.
So we help people prepare for life and for death. What we spend a lot of our time, especially right now, is with health insurance. My part of the business that we do is the under 65 for those who are trying to find affordable health insurance. What I also find is a lot of people don't understand health insurance. What's deductible? What do you mean out-of-pocket maximum? That kind of stuff. So I spend a lot of time educating as well as helping people make that decision in their life so that they will not be, some catastrophic situation comes in their life and takes everything they have.
That's correct. And I do the opposite. Everything from 65 on up, I do mostly Medicare. And for those who are over 65 and are disabled. And again, we do that so they can understand how the system works, what it means for them, and how to stay as healthy as possible as they age. That's become starkly clear to me this week since I turned 65 myself. So you have to take care of yourself, and this is kind of help with that situation. Yeah.
One of the things we have found as we listen to people talk about Medicare is that they will call, I'm Medicaid. No, you may not be Medicaid, you may be Medicare. And the words sound so much alike, and we thought today it might be just a little bit helpful for just to kind of, what is the difference? Where it becomes the difference in people's lives is often later in their life when they're looking at skilled nursing. So what's the difference? I must have just hit the wrong one. There it is. So Medicare is a federal health system for those age 65 and older and for those who have been considered disabled, that they have that through Social Security.
You have to be disabled for 24 months before you're eligible for Medicare unless they expedite it. And the only time they expedite it basically is if you have end-stage renal disease or some other thing that's life-threatening terminal illness.
Like ALS.
Yeah, ALS is a too.
Mm-hmm.
Yeah.
And Medicaid is both a state and a federal program, and it is for those with lower incomes. What I have seen is in the state of Missouri, Medicaid usually only affects those who are 18 and younger or that are 65 and older. And the only exception usually will be a woman during a pregnancy can qualify for Medicaid. That is the only age groups that qualify for Medicaid as a health system.
You might know it as Missouri Health Net. That's what it's called here. Every state's different, and every state has different requirements. So it's interesting because I'm licensed in about 8 states, and it's very difficult keeping up with all the different requirements for each state as far as Medicaid. It's very important, though, because some people are what they call dual eligibles. They're eligible for both Medicare and Medicaid. And if that's the case, it's illegal for an agent such as myself to sell them a Medicare supplement. I cannot do that. But we can talk about an advantage plan, which we can talk about here in a moment.
Medicare is actually made up, it's like an alphabet soup. And Part A is for anyone who's worked at least 40 quarters in their life, they will have Part A at no cost, and that pays for hospital. Part B pays for your medical. That has a premium. I jumped down to Part D because that has to do with drugs. Now, if you happen, one of the options is you can go with Part C, which puts A plus B plus D all together in one plan.
That's correct. And
I have to look at him because he's the Medicare expert, not me.
Well, it's interesting. I have people, for instance, it's very common nowadays for a person to continue to work past 65, and they have health insurance through their group, wherever they work. So they say, well, do I have to still sign up for Medicare? I said, yes, you do. If you don't, you will be penalized. It'll be very difficult to, you'll have times where you won't have Medicare if you don't do it correctly. Anyway, I can go into that some other time, but the point is, if you still are working and you have a group plan, you must sign up at least for Part A of Medicare. It's free, it doesn't cost you anything, and you sign up for that. You do not want to sign up for Part B. There are 2 ways a person can get a Medicare supplement guaranteed issue. One is to turn 65. The other way is to activate Part B of Medicare. So if you delay Part B until you're finished working and you sever your relationship with your employer, then you sign up for Part B. You have 8 months to do it. So once you sever your relationship with them. By the way, when you sign up for Part A of Medicare, when you turn 65, you actually have 7 months. 3 months before you turn 65, the month you turn 65, and 3 months past that. Now, if you go beyond that, that's when the clock starts. You will start being penalized at that point. Those penalties last for your lifetime. They do not go away.
So again, just to remind you that what on both sides, what the Part A pays for and what the Part B pays for, and you do make a premium every month. Drugs.
Go back for just a second,
sorry.
if you
Okay.
would. Part B of Medicare, there's a cost involved there. When you sign up on the Medicare website, if you do that yourself, and instead of going up to the Social Security office, you go to Medicare.gov, not Medicare.com. That's a private thing. Medicare.gov. And you'll look on the left-hand side there, and you'll go down, there's a column of things you can click on where it says, sign up for Medicare. Very easy, and it'll guide you right through it. But once you get to Part B, they're going to ask you specifically if you want to sign up for Part B. And the reason they do that is because there's a charge involved, $135.50. Then they're going to switch you to for a moment over to the Social Security .gov website, because it's going to come out of your Social Security. If you're not taking Social Security yet, what they do, Sandy and I, for instance, do not take Social Security yet. We're both on Medicare. They bill us every 3 months, every quarter. They just send us a bill. When we decide to go on Medicare, or on Social Security, then they will take it out of our Social Security. And by the way, there's no choice. You don't get to say, well, I'll just write you a check for the year or whatever. No. They take it out of your Social Security every month. That's the government, and they do it their way. So that's how it works. But this has to do a lot to do with being mostly hospital. Okay, if you can keep it that way, Part A is hospital, basically. When you're actually admitted to the hospital. Without a supplement, by the way, you pay $1,364 each time you go in the hospital for a different illness or injury. That's your cost, even if you're on Medicare. So just if you don't have a supplement, because otherwise your supplement will pay all that for you. So it has some nice stuff there. Once you've been in the hospital for 3 midnights, that's a different way of putting it, but it's more accurate. When you've been in there 3 midnights, the morning of that 4th day, they can release you to a rehab center, which oftentimes is another part of the hospital, or to a nursing home, or someplace else where you can heal up. Yeah.
Make sure that you're actually admitted as a patient and not
under observation, that's for sure. Yeah. Under observation are bad words. Medically necessary are good words. So it's just some things, tips. If they say, we just want to watch you for a little bit. No. Either you admit me or you don't.
This is something that came up a couple of times, and I remember Debbie Eckhoff said this. She had just been at something, and we said, do not let them admit you into the hospital. They don't admit you. They keep you under observation, because Medicare will not pay for that.
They won't.
And it happened that they were going to do that with Roger, and he said, wait a minute, what are you doing? And they said it again. He said, no, either you admit him or he's going home.
I've had people...
She knew what he paid for.
I've had people dismissed from a regional hospital right here in the area with a bill for anywhere, as multiple times, different ones. One was $11,000, one was $18,000, that they got to pay, and they didn't know that. We, of course, appealed all of that, and it was eventually worked out, but because they did not have, at that time, did not have a disclosure statement, which I took exception to. I met with the CEO of Bothwell Hospital for one, and then went over to Golden Valley to another, and said, you need to have a disclosure statement in bold print saying that these people are going to be liable for this bill. Otherwise, you're going to eat this bill. And they did. So that was a good thing.
So in our regular health insurance, prescription drugs are often a part of whatever health insurance you have. After you are eligible for Medicare, your drugs become a separate plan, and it's a separate part. And that, when you see all the advertisement you've got on TV right now, there's every company trying to convince you that you need to go with their plan. It has to do with the drug plan or the Medicare Advantage plan. But this, every year during open enrollment, you can adjust the drug plan
What people do not understand sometimes is there are 28 plans this year, 28 different prescription drug plans. What we offer for you, many people do, a lot of the agencies around do, is that we look to, or do it yourself, actually. Go to Medicare.gov and do a comparison. And it'll tell you which plan really works the best for you. Given your medications and where you buy them, and by the way, it is store specific. It actually, all the stores are numbered. These are the amounts that they're supposed to be charging you throughout the year, give or take. They don't adhere to that, but anyway.
That didn't come out pretty.
Part D, by the way, was that goes back to 2005 under the Bush administration. That was the Dev and Advantage plans. They all came at that time, 2005. So we've had them quite a while now, and they're unfortunately not improving all that much. If any of you have COPD, any of you have anything to do with breathing, insulin, arthritis medications, if you haven't noticed it already, those prices are going through the roof. Don't ask me why. I think it has something to do with GREED, but that's just me.
So one of the things that we don't often think about, and this is again kind of that whole preparation for what ifs in our life. At some point in our time, every one of us is going to be able to not be able to do one or more of what are called activities of daily living. And those include bathing, dressing, eating, transferring, toileting, continence. And this can be the result of a stroke or a heart attack, cancer, dementia, Alzheimer's, accident, and injury. Now, it's not that we want to stand up here and tell you that there's all kinds of plans out there you need to buy. But the point of it is there are some things that can help you prepare for the unexpected expenses that happens with these kind of things. For instance, your insurance Medicare is going to do a great job paying for your chemo treatments or your radiation treatments. But it's not going to pay for the travel that you have back and forth. It's not going to pay for you really can't eat. You can only eat if you go out because the food makes you sick. It doesn't pay for someone that might have to come in and help with your laundry, whatever the case may be. Take care of your children. So there are things out there that what happens is upon a diagnosis, then you get this lump sum of money. And that lump sum of money is up for you how you spend it. It may be $20,000, $30,000, $40,000, whatever you choose. But it can be used to build the ramp that has to go in front of your house or different things like that. So that's one of the things we wanted to...
Yeah, actually, I came sensitive to this. I used to say that cancer policies were a waste of money. And I even counseled people just forget about all that. And then I realized I had people here in this congregation that enlightened me because they were going to Anderson down in Houston. And the kind of money they were having to spend to go there. I also had some clients that went to Mayo Clinic up in Rochester, Minnesota. You know, they've been going to go to get the best care in the world. I mean, these are world-class places. And the money they spent on that was holy mackerel kind of stuff. I mean, it was stunning. So I started to realize, there was a reason for these policies. Just the help with, so it wouldn't be a devastating loss to you and hurt you. Some people it limits their choices. They can't go there because they don't have the money to go there. They can't get world-class care because they don't have the money to afford that. So they got to do whatever we can do right here. And by the way, I've heard also great things about cancer centers over at KU and over in Tulsa. Both of those have been outstanding service from what people have been telling me. Just to let you know that.
And part of that process is that we heal better, we take care of ourselves better when we're not worried about the financial strain it is on our families. Now, there's different ways that we can look at, the word we're going to use here is legacy. How do you protect your legacy? How do you continue providing for family or whatever the case may be if something catastrophic happens?
Yeah.
There's different processes to that. We just mentioned there's cancer plans, there's critical illness plans. Really, they don't cost that much compared to what you pay for other things. Short-term care, there's some products out there that may give you 2 years in a skilled nursing home.
So does the critical illness. The critical illness has been sort of overlooked. But it's an alternative to fairly expensive long-term care policies. Some people, as soon as they wake up to the fact that they might need a long-term care policy, and by that time they can't qualify.
Right.
It's easier to qualify for life insurance than it is to qualify for a long-term care policy. They are strict, so it's really difficult to do that. But critical illness, for instance, it covers things like cardiac problems, Alzheimer's, and it'll give you up to 2 years of care in a skilled nursing facility. And it's for a lot less cost than it would be for some of these long-term care prices. I happen to have a long-term care policy myself. And the reason why I did that a number of years ago, but I did it because of my knees are shot and my hips are going to go. I know I'm going to have some kind of care at some point. And Sandy's not going to do it. So she said, ain't happening. So I thought I better have some. But I loaded mine up on home care so that I could get most of I'm hoping anyway, have most of my care at home, and then the day that I die, I'm in the hospital. But anyway, that's kind of where that's at.
And
by the way, most people, just to let you know, I've talked to the administrators of both Lincoln, here, Stover, and it's pretty much the same story. About 70% of the people that are in those facilities are on Medicaid. Medicaid's paying for that.
here you go.
Which means you're paying for that because it's taxpayer money for the most part. But anyway, we'll get into that in a second.
So when Medicaid can come back into your life if it hasn't before, it can be at the time that you go to the nursing home, because at that point in time, they look at your finances differently, and the cost of your care is different. And Paul looked up to get the most final notes, and I tell you what, this won't make any sense to me, and it may not to you, but for those of you that this does make sense to, it kind of gives you a breakdown. He'll explain a little bit.
Well, people always ask me, what does it take for me to qualify for Medicaid? That's a loaded question. I mean, that's a tough question, because it's very dependent on what level of help you need. Sometimes it's as little as help as getting Part B paid for, and that's not really Medicaid. That's what low-income subsidies. To Medicaid, full-blown Medicaid. Here, you have an asset limit and you have an income limit. But there are certain assets that you can't count, such as personal belongings, a primary residence, one car, personal belongings, other property. But you have other properties, many of you farmers, and that's countable assets. You would have to liquidate those before you would qualify for Medicaid. If they think it's a cash or cash equivalent asset that you have, you're going to have to use it. And that's called a spend down. So it's not pleasant for some people who are land rich but probably cash poor. I see a lot of that in our Morgan County, Benton County, Pettis County area.
So the information that's up here is...
I found this interesting, though.
The home cannot be worth more than $585,000.
Wow.
We all would make it there, I think.
Pastor, your house, not more than $585,000.
Yeah. But there's other pieces of, that looks like a humongous amount. However, you may still have that while you're in the nursing home. You may qualify for the Medicaid. However, when you are gone, they will. What's that group called? Recovery. The recovery.
It's a state recovery team from the state of Missouri. And I met the woman who heads that team and had a conversation with her at a seminar, and she says we're not bad people. We are charged by the people of Missouri to come after the estates of those who we supported with Medicaid for a number of years when they were in the nursing home. So if there's money there in their estate, and they up to the limit of care that they were provided, they have to pay that back. That's taxpayer money. So, if you think about it, that's the way it should be. That's the way it's supposed to be. It's interesting to me also that I get a lot of husband and wife questions. Usually it's the husband goes into a nursing home first, but it doesn't always happen that way. But just for example's sake, husband goes, they split the assets the day that happens. You have to be impoverished to get Medicaid. That means you have to spend down the assets that you have. Any income that you have can be applied to the would be applied to the cost of the care. Now, that's even a little hard to nail down because the spouse has certain rights too. And so she keeps the house, she keeps the car, a certain allowance here, which you can have up to a certain amount. The applicant themselves, when they're in a nursing home, get $50 for personal items. And that's it. People think I'm kidding. I said, no, that's the mandate from the state. I just got this off their website yesterday. So it changes all the time. It's always an ever-changing thing in our state. So there you go.
So we also are involved with preparing for death or end-of-life planning.
Little story,
Yeah.
if you don't mind. This was, again, a little story about life insurance. I had a man come to me. He needed health insurance for his family and himself, so I wrote that. This was in Colorado again, back in late 77, almost 78. And wrote his health insurance, and he said, I also need some life insurance. I think I actually have some life insurance. So he bought, at that time, what we thought was a tremendous amount of life insurance. It was $100,000. It wasn't 6 months, and he was killed in an automobile accident. And I found that out because his wife called and said that he had passed away. What do we do about the health insurance? Do we need to do anything about health insurance? She didn't know that he had taken out that life insurance policy. When I walked into their house, her house, it was in Lakewood, Colorado, 2 little girls, and she was obviously red-eyed and beside herself. She lost her husband suddenly, boom, just like that. And I was the only person of the people that came into her house. I was the only one that came in there bringing money in. The rest of them took money out. She had no idea how she was going to pay the mortgage. She had no idea how they were going to live. She didn't have a job. She was taking care of her kids. He was a pretty good wage earner, and so he took care of everything. And she was, and when I said, you don't realize that your husband did this, do you? He bought some life insurance. And she kind of looked at me like, what? I said, yeah, this is back when you could do that. And I had a check in my hand. I said, this check is for you, from your husband. $100,000. She broke down. Boom. Just broke down. Her life was over, and then it was renewed. Her girls had an education. She could pay the mortgage. She could live her life again. And she went back to school, actually, got a better paying job. Paid for by life insurance. So if you want to come into my office and tell me that it's, like one person did that I kicked out not too long ago, and tell me that it's a sham, I said, you don't know what you're talking about. Get out, there's a door. You have no idea what you're talking about. I've been there. So it's an interesting experience to be able to, it's just life-changing for me. It was a wonderful experience to be able to do something like that.
So the question is, how much money is needed at the time of your death? And these are some of the things that can be involved.
You'd be surprised. Well, it's just you can't walk in and say, I want to buy $5 million worth of life insurance. You can't do that. What's your insurable loss? What's the maximum? Well, you take a wage earner, like anybody in here, $40,000, say. Doesn't matter what it is. $40,000 over maybe, say, a 30-year lifetime, 30-year period. That's $1.2 million in possible lost earnings, just in that. So you can have a very sizable life insurance policy. You can do it with a combination of term, which has no cash value. This is usually very cheap insurance. I've got people in their 20s that pay less than $20 a month for $500,000 for life insurance. It doesn't cost that much. But you can also have whole life insurance, which can protect you not for a period of time, like 20 years, but for your entire lifetime. And it's very expensive. Well, comparatively speaking, it's very expensive. But it also has guaranteed, it has a cash value that can be borrowed against, that you can use in the future for your kids' education, for any number of uses, if you want to. So there's some real plus things there. We have to go into details about how it works, but there's some magic to life insurance.
So one of the
With a
first
stroke of the pen, you can create an estate.
So one of those that you can get, that's kind of important. It's called final expense. And what does it pay for? It can pay for your funeral expenses, cemetery plots, for a gravestone marker, food you may need to have when more people are in your house, even though people are pretty good about bringing food here. Travel expenses. You know, we don't often think about it. The younger generation maybe working in Texas or Alabama needs to get here quick as an airplane ticket, and they're not cheap when you have to buy them at the last minute. So those are things that a final expense can kind of help cover, so that everyone doesn't feel stressed by being at the funeral. Also, one of the things that we have to think about is when you're gone, who will there be debt and who's left to pay for it? No one wants to burden their family with debts like home mortgages and vehicle loans. That's a way in which you can help those you leave behind. Income replacement, Paul was just talking about that. In most homes today, if they are two adults in the family, they are both wage earners. And when one of those wage earners is no longer able to be there giving income, how will your family pay the bills? Because most of your budget's been built on two wage earners. Can they live on more income? Another thing is the whole thing about education. Your children, grandchildren may need, will want to go to college or trade school. The spouse may need to go have more education or training so that they can be create more income within the budget. Also, something that Pastor was just touching on a while ago is the healing process. I have to tell you, this is a true story. My husband decided to buy, I had a life insurance policy, and he decided to buy another life insurance policy on me. It made me a little suspicious at the time, but anyway, he said to me, he said that I need to have time, and I may not be able to work for 2 months, and I want to know that I have an income coming in, that I don't have to worry about that. If I need to take the time to grieve, if I need the time, take the time to go into therapy, whatever the case may be, and I need to know that I can do that. And so he released me. I wasn't quite as suspicious anymore, but it was a way to say I need to have something that's a legacy that helps me to get on my life. And that was the way that he could see life insurance as a possibility.
I did the same thing with my son, and I bought $100,000 of life insurance on him before he left for Afghanistan. And it wasn't because you take advantage of it, but the fact that he was putting himself in harm's way, and found an insurance company that would cover acts of war. Anyway, we knew that the number one, I don't know what you call it, fallout from losing a child is divorce. What happens almost way too often is when a child dies, oftentimes a divorce happens shortly after, because they don't take the time to do the grieving and can't grieve or whatever. But I bought that for us so that we could get professional help if that happens. So we could keep our marriage together and keep living in case we, and pay bills and things while we're in that healing process. That's very real. I'm going to turn that over to him now, to my son. It was a term policy. But with most term policies, you can convert that, any or all of it, to whole life and keep it for the rest of your life if you want to do that, if you do it before the age of 65. So I'll turn it over to him, and if he wants to do that, he can name his wife as a beneficiary and have some protection for his wife and his children.
And I had the same thing happen to me when one day I went down to pay the car insurance premium or something like that. And he was a really good sales agent, and he put a quarter and a dime out on the table, and he said, for this much money a day, something like that, you can buy a life insurance for your son. At the time, Noah was 2 years old. And so I spend $10.25 every month, and it's a $25,000 life insurance policy, whole life policy. Yeah. What happened, several people who called me because it's the worst thing in the world, but they brought lost a child and they didn't have a life insurance policy. So not only are they dealing with, oh my gosh, the worst thing I can ever imagine in my life, but they also have expenses that they weren't expecting nor maybe be able to afford. So I've kept that, and it is a whole life. It's got a little cash value now, but it's always been there, so that if that day ever happened, that was there for me, and it only cost me $10 or $25 a month. So.
Well, now you have a brief overview of what we do at our agency, and we consider it an extension of our ministry that we've been in since our 30s, a long time ago. But that's kind of where we're at with what we see as necessary. It's helping people prepare themselves for hopefully a healthy life, a healthy family life, community life, as well as having hopefully some love that they can give to future generations through perhaps life insurance or their estate that they can pay for long-term care rather than having to have it paid for out of their own estate. They could have it done through life insurance, through long-term care insurance. But anyway, trying to help people with the practical parts of loving each other.
So we leave you with this question: what do you want to leave as your legacy, and to preparing for those days that we don't want to talk about, but it's a good thing to have a plan. Also up here we have, this is something Paul had found several years ago. It's back when Chris Koster was actually Attorney General. And it is a book called Life Choices. And for everything that we're going to discuss as we continue to meet together, there's something about it in here. It might be a nice way to prepare when an attorney comes.
I thought if you could read this, or at least parts of these things before the lawyer, I believe there's a lawyer going to come and talk about some of those things, trusts and all that. If you read some of this, I think it would give you a leg up on some of those terms for one thing, but also understanding how to use those to the benefit of you and your family. All those financial
So
instruments.
you'll see them in the nice shiny one, and this is the same thing that I just made more, so that there'd be plenty for at least every household or every person who would take
It's
one.
an interesting thing, though. You look in here, though, it's got questions I found interesting. It has questions like, what is it that you would like to say to your family before you die? And I thought, well, that's kind of an interesting question. What is it you haven't said that you need to say before you die to those that you love? Oh, wow, that's in that book as the kind of questions. You have to kind of think through some of that. Those kind of questions is kind of interesting. What do you want to say to your grandchildren, even if they're not born yet? You know, what do you want to say to them? You could leave them a legacy. Anyway,
And then we just have a few of these kind of things: Medicare and skilled nursing facility care benefits, and this one's long-term care. So, as we said before, it's not meant to be a sales presentation. We just have some ways we've thought about things, just because what we have seen people, what they have had and what they haven't had, and how it made a difference in their lives. So, thank you.
yeah, thanks a lot. Questions? We can entertain a few questions if you want to. Got a few minutes here. Anything? Yeah.
Point again on Medicaid.
Uh-huh.
After the individual is in, let's say, the nursing home, and they've been on Medicaid throughout the whole time that they've been there, and then you were talking about paying back because if it's being taxed, the taxpayers pay for it. What if there is nothing?
Then they can't recover anything. She's made that very clear to me.
Okay.
Yeah, if there's nothing in the estate, then obviously that's.
So they're not going to go.
Yeah.
Okay. I didn't know how they.
I've had people in my office, for instance, who basically have zero assets. They have nothing. And when I've asked them to go talk to a counselor, you can go to the Division for Family Services here in Missouri and other places and talk about getting on Medicaid. You know, because they're limited. I have a lot of clients, for instance, who live, especially I say the widows, who live on less than $800 a month. When they live on less than $800 a month, they shouldn't be talking to me about buying a policy. They should be talking to somebody about being on Medicaid, being dual eligible for Medicare and Medicaid, because it's going to be while they're alive, paying for their health insurance, for all their health and dental and everything else that comes along, and also if they go in a nursing home, paying for that as well. So they have care throughout their lifetimes. These are human beings we're talking about. You know, They should have the right to have good care throughout their lives, not just because they're poor. So, any other question? It's interesting though. It's an intricate question. You know, when people say, "Well, how do you get on Medicaid?" It's not as easy as it sounds. I mean, especially Missouri was not an extension state. You know, when they had Obamacare come in, we did an Affordable Care Act. Came in, you know, you could actually extend Medicaid, or you know, in the state. We didn't do that in Missouri. Instead, they tightened down on it. So it's hard to qualify for Medicaid in the state of Missouri. You have to meet strict guidelines. But you know what? You don't have to go full blown. You can get all kinds of assistance. I have a lot of people who get their Part B paid for instance. Part B of Medicare is $135.50, and there's 2 people in the house. You know, that's a lot of money. If you can get that paid for, that frees up a lot of money to do for other things, just to live. That's grocery money. You know, pays a light bill, $200-300 extra. Yeah. Anything else?
There's advertising, you know, coming out on Medicare stuff.
Oh yeah.
And some of it says,
Oh sure.
you will no longer be eligible next year for da.
Oh, let's clear that up right now too. Yeah. If for those who are new to Medicare after January 1 of 2020, you will no longer be able to get a Medicare supplement Plan C or Plan F. They're gone. For new people. If you have a Plan F now, or Plan C, you can keep it. I still have people who have Plan J. J came into effect, basically it was a Plan F, which is, by the way, the Cadillac of the industry. It helps fill in all the gaps, Medigap insurance, fills in all the gaps on Parts A and B of Medicare. Anyway, he has a Plan J. And back in 2005, when they came out with Part D, all the prescription drugs, there's no need for a Plan J because J was actually an F with drug benefits on it. Well, they took the drug benefits off, it became an F. So people on J's basically just moved over to F and, you know, went merrily on their way. But this person kept the Plan J, still has it to this day, and he's right in the fray. It didn't, there's no real difference. He can keep it if you want. And that's the same for now. So in January, I've got people, for instance, who are already talking to me about going on Medicare after January 1, and I have to tell them, you cannot have a Plan F. You can have a Plan G, and the Plan G is identically the same as a Plan F, except you pay the $185 Part B deductible. That's $185 a year on Part B, everything outside the hospital. Okay. If you're willing to pay that $185 even now, you can save almost $500 in premium. Plan Fs are way overpriced, by the way. Just let you know that. So if you have one, we might want to talk because they're really overpriced. But you don't have to do anything. You can keep it forever. I have family members who have Plan F and they will not move. They like it. So, you know, it's what your personal preference is.
So for those, oh, excuse me.
Paul, so are you saying if you have a Plan F now that after January 1, it will go up to $185?
No. $185 is a plan, is just a deductible that you pay.
Okay.
But yours is paid for. If you have an F, that's paid for. You have no deductibles, no co-insurance, no nothing. What you pay for your premium on your supplement, that's it. There is nothing else. If your bills should be paid inside the hospital, outside the hospital, I don't care. With my clients, I say if you get a bill, I like to see it. I want to see it because something's wrong. They did that to my dad, by the way. It was just a mistake. He had 20 radiation treatments. They tried charging for 20 of them, or for 10 of them. 10 of the 20. I said, no, he's got a Plan F. There's no way that's possible. We looked at the DRG list. That's the diagnostic related groups. That's how they code everything. And I said, I would like to see that list. And sure as the world, they had reversed 2 numbers. Somebody who's putting it in, just a mistake. They put it, reversed 2 numbers. We reversed those numbers back, resubmitted it to Medicare, and it was paid. I also had a woman right here in Colcamp who had to have a second mammogram. And here's where those words come in effect. And Medicare denied it when they put it through. I said, no. I said, so I called her physician, which was not easy, by the way, but I did. We actually got him on the phone. I said, I've got to ask you a stupid question, but I have to ask it. Was it medically necessary? She said, absolutely. because of this reason, that reason. I said, would you put that in about 3 sentences for me and on your letterhead? That this was medically necessary procedure, blah, 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 when this is why, blah, blah, blah. He did. We submitted that, and they paid for it. What they're looking for is fraud. A lot of people out there try to stick it to Medicare, and so they're just looking for fraud.
And that's true of under 65
Yeah.
as well. This is just about 5 years ago. There was a new law that came into existence, and part of it was to affect Medicare, but affect all of us. The Medicare, the government promised the doctors they're going to pay them more. But to do that, they also multiplied the medical codes that they used by about 100. So, or maybe more, 1,000. But there's like 100,000 codes now, something like that. So it's very easy for the medical people in wherever you go to get the wrong number down for whatever happened. So when I have under 65 people come back and bring me a bill, I say the first thing is, let's just double check the codes. Let's call the doctor's office and make sure the codes are right, because you want it to get through the system correctly. Yeah. And it's understandable mistake if you write down the wrong number or code it wrong. But that's how they determine whether it's fraud or not, and if it's a payable situation.
Here's also another situation for those of you on Medicare. You have a bill, say it's a MRI and it's $1,000. Medicare approves 800 of it. Medicare is going to pay 80% of 800. Your supplement will pay the other 20% of the 800. That still leaves $200 there between what they're charging for the procedure and what Medicare is going to pay. They cannot come back on you and balance bill you. It is strictly illegal to balance bill in the state of Missouri. I have to remind some of these people every so often, you can't do that.
Over 65 in Medicare. Under 65, that's not true, and they can still balance bill you the rest of the month.
Yeah, well, there's a difference.
Yeah.
Also, people always ask me this question, is an air ambulance covered under Medicare? Yes, it is. Fixed wing, rotary wing, and ground. Only criteria is that it has to be to save your life and go to the nearest facility. That's it. It's there for emergency purposes. It is paid. We had an instance right here where they flew from here to Columbia, $22,000 bill. Medicare approved $11,000 of it. Of course, those people were very upset. I said, well, your problem is not with my people. Your problem's with Medicare. You need to write down why, give them a compelling reason why you should have a higher reimbursement for this, for your services. They did do that, and they actually now get higher reimbursement rate. But they were going to turn it over to a collection agency and say, yes, you're beating your head against the wall. It's not going to happen. You agreed with what Medicare would take when you took a Medicare patient. That's how it works. Now, what happens if they don't agree? What if a person, a hospital or a doctor does not take assignment, which means they don't agree with Medicare? They can charge you legally up to 15%, 15% more than what Medicare will allow. But that's the limit. That's all they can do. So sometimes when I see a bill come in, and I check that first. Was it within the 15% limit? And then I also look, because they have to tell you on there that they did not take assignment, that they didn't agree with what Medicare would allow. So anyway,
so
sometimes the bills tell you a lot. I also have bills, by the way, come in and says this is not a bill in bold print. And I still have people bring it in thinking they got to pay this. And no offense to some of you out there, but there's a lot of you in your 80s that love to pay your bills right now. I have to slow you down. Let the process work. It takes sometimes a month. Relax. It'll happen.
So we love what we do.
Yes, we do.
And
Okay. We're done. Thanks for having us.